Well, it's time for our health report, and joining us now is Africa 54 health correspondent Linord Moudou with details on the lack of medical care and education for many of the world's children. Lino.
The United Nations Children's Agency says nearly a quarter of the world's children live in conflict or disaster-stricken countries. UNICEF says an estimated 535 million children live often without access to medical care, quality education, proper nutrition and protection. Sub-Saharan Africa is home to nearly three-quarters of the global children living in countries affected by emergencies, followed by the Middle East and North Africa, where 12% of these children reside. UNICEF says the emergencies faced today by the most vulnerable children threaten to undermine immense progress made in recent decades. Since 1990, the number of children dying before their 5th birthday has been reduced, and hundreds of millions of children have been lifted out of poverty. The impact of conflict, natural disasters, and climate change is putting children at risk of disease, violence, and exploitation. As 2016 nears to an end, let's take a look at some of the stories that were significant this year. Here is VOA's Carol Pearson.
Zika is such a mild illness that most people don't know they have it. But in the past 2 years, a surge of babies born with extremely small heads showed the world that Zika is anything but harmless. The virus originated in Uganda more than 60 years ago. It recently emerged in Brazil, then surged north to Florida, and possibly to Texas. Dr. Anthony Costello with the World Health Organization said even one affected child has a very big impact on the community and a family's ability to cope.
It's a public health problem of huge concern for the world. 69 countries have seen Zika virus emerge in the last 2 years. We're talking about a virus that causes brain damage and potentially lifelong disability, which is a huge blow to families.
Right now, doctors can only advise women not to travel to areas where the virus is spreading, to avoid mosquito bites, or to delay pregnancy. There's no vaccine against Zika, but one could be available in 2018. In Nigeria, the polio virus reemerged in the violence-racked northern part of the country, where it's hard to make sure every child gets vaccinated. 3 children were diagnosed with the disease just when Nigeria was thought to be close to becoming polio-free. The virus also exists in another conflict zone, along the border of Pakistan and Afghanistan. Those behind the effort say they are determined to eliminate the disease. Polio cases have decreased by over 99% since 1988, from about 350,000 cases then to less than 3 dozen in 2016. At the beginning of December, the National Institutes of Health announced the start of a major trial of an experimental vaccine against the AIDS virus.
An HIV vaccine is not going to be easy. We may not even know if we're going to get a vaccine.
Fauci described the advances in AIDS treatment as nothing short of spectacular.
Today, the combinations of therapies we have for individuals, if someone's in their 20s and gets infected and comes in and gets on a combination of drugs, you could predict that they would live an additional 50 years, 50. That is one of the most extraordinary advances in the transition from basic research to an applicable intervention in any field of medicine.
If an effective vaccine can be found, it could finally mean the end for a virus that has infected more than 70 million people and killed 35 million people over the past half-century. Carol Pearson, VOA News, Washington.
Turning now to tuberculosis, medical experts say substantial progress is being made in reducing the incidence of TB over the past 2 decades. However, the disease remains a major cause of morbidity and mortality globally. Studies published in the medical journal The Lancet says diabetes prevalence is threatening to hinder progress in global tuberculosis control. In our Ask the Expert segment today, we spoke with Dr. Ariel Pablo Mendes, the Assistant Administrator for Global Health at USAID, and asked him, how does diabetes affect tuberculosis?
Just as HIV allowed for TB to spring back in the United States 20 years ago, now we are seeing a growing global pandemic of obesity and diabetes. And diabetes also permits tuberculosis to be activated in people with the disease. Diabetes predisposed to many infections. It weakens your immune system. The actual mechanism is the subject of a lot of analysis, but pretty much people with diabetes have double risk to developing tuberculosis than people without diabetes. And because we are seeing a lot more diabetes everywhere, we can expect that to play a role. Although the majority of cases will still be in people who didn't have anything. And just like HIV was only one factor, about 10-11% are related to HIV, the majority are related to just poverty, malnutrition, and the fact that people were born in places where tuberculosis happens to be around us.